Alrighty, welcome back to 1011 News at Noon. Joining us now is Caitlin Rogge with the CHI Health Clinic. How's it going?
Good. How are you?
Good. I mean, I just can't believe July is flying by. School's just around the corner. And, you know, with that, there's a lot of different tasks that go into back to school prep. But, you know, getting that health screening for those kids that might want to participate in sports definitely should be a priority on that list. So I'm just curious, you know, with that being said, could you explain what a well child visit is and who should get one?
Yeah, so well child visits start at age 3 annually. Before that, more frequently, depending on vaccine schedules and things like that. But after age 3, your child should be coming in annually to get just an overview of their health, physical, developmental, emotional, analysis with the assessment that we do in clinic to see how they are meeting their milestones and how they're doing overall. Let parents come in to talk about concerns, things like that, update immunization history and everything. And then if they are participating in sports, that's a good time to do that, in the summertime leading up to the school year, because we can do a sports physical in combo with that well child check. But a well child check overall is more in depth and more established with kind of their home base for health, whoever their primary care provider is.
Gotcha. And you're talking about double stacking there. What if somebody that's already had their well visit for the year but needs their sports physical? Does that also work as well?
Yeah, so they can come in. They actually have a special through CHI where you can do self-pay for $40 to have just a sports physical done for that sports clearance, where they will do a physical assessment. They will do vitals. They'll make sure that there's no red flags for participating in whatever activity or sport that the child is participating in. And these visits can be done for up to 24 years old. With that, it's like I said, self-pay is $40 if that's what they want to do, or run it through insurance, depending on insurance, preventative care coverage, usually just one of those per year, but there are multiple options for that.
All right, I mean, you took the words right out of my mouth. I was going to ask about that nice discounted price deal. I mean, that sounds really nice, $40 for that kind of a checkup there. But yeah, and then now, are appointments needed for these kinds of visits?
They are, if you're doing a well child check, yes. So that needs to be done with your primary care provider of choice. And that is a scheduled appointment preferred. As for the sports physicals, if you're wanting to do that as a walk-in, you can go to any of our priority care locations at Yankee Hill, Antelope Creek, or Stevens Creek, and you can do a walk-in appointment for that. If you want to do a sports physical with your primary care provider, they do prefer to have an appointment for that as well.
All righty, a lot of useful information. Caitlin, thanks for stopping by with all that stuff for us.